Good evening to all of you. So today we will continue with our Organon series. There is a question regarding the local diseases. The question is freckles or melasma the hyperpigmentation on face local diseases? If yes, doing laser to treat hyperpigmentation or these kind of lesions, to remove these lesions on face, is it harmful? Okay. So when we started with this particular part of the how the treatment should be done, this local diseases, they come under the heading of one-sided diseases. So we have basically two kinds of one-sided diseases. One is the local disease, and one are the mental diseases. Okay, so when we started with it, so the first thing is one-sided diseases. What are the one-sided diseases? Diseases where there is paucity of the symptoms, where we do not have much symptoms, where we do not have enough symptoms to prescribe on, we don't have much characteristics, we don't have such symptoms in the journals or in the peculiars where we can prescribe. There we say that the disease is a one-sided disease, where all the disease is basically concentrated on one organ of the body. So in that case, then there is a subdivision of that one-sided diseases, which is the local diseases, where the diseases are basically concentrated on the organ of skin. So coming to the question, if this kind of symptoms, for example, this melasma or this thing, it comes in this category where that there is no other symptoms in the body, no other characteristic of the disease, like for example, no other the symptoms of the gastric system, respiratory system, or you do not find the disease where it penetrates the other tissues or the organs of the body, then we can call it a local disease. Then that discoloration, then that melasma, then that kind of freckles, they are basically one-sided disease, a local disease. Although not troubling, although not giving any kind of much trouble, or they're not some kind of the things which are painful or this thing, but still they are present, we can call them the local diseases. But if these kind of symptoms, they're coming up with other symptoms, for example, there are symptoms of liver, some problems with the liver, with the indigestion, with some kind of dyspepsia or something like this, then they can be associated with those kind of problems, or they can be part of the original sura which is running through the body, but then they will not be in the category of one-sided diseases. Although that is a local symptom, although that is a symptom of the skin, but we will not call it a local disease. We have to understand this difference. Okay, the symptom is of the skin, but we will not call it a local disease, or we will not cure it in the way where it is said, like we have discussed in the last part. We have to see all the symptoms, whichever remedy is being given by all the symptoms, we have to prescribe that along with the characteristics of that skin symptom, if there are any. But if we are in those kind of diseases also, if we are looking only at the characteristic of the lesion, only at the characteristic of the skin, what kind of discoloration it is, the color of the discoloration, and giving or prescribing only on that part, then that is not fair. Then that will not be a homeopathic prescription. When Dr. Hahnemann has started with these aphorisms of one-sidedness, the first thing is that he said is that when the symptoms are not much, we only have one or two symptoms, and those are the only symptoms which basically tell us about the disease which is going on in the body, and we are kind of helpless there to just prescribe on that. And even he says, going further, that it can go into two things. Two things can happen: either that will be cured from there, it will be gone, the patient will go into healthy state, or the symptoms which were lying or which were in a latent stage, they might come up, and then we will have to come up with a new remedy which basically is equivalent to those symptoms, which is similar to those symptoms. So understanding of this thing, yes, the melasma or this thing, they basically belong to the skin part. They are local symptoms, but they are not only a disease when it is coming in conjunction to the other symptoms in the body. Okay, so we cannot just prescribe on that part, because in actual local diseases, when we are not having much of the symptom, we have to find the characteristic of that lesion on the skin. We understand that lesion, we try to find out the characteristic of that lesion, and we prescribe accordingly, because we don't have many other symptoms of the journals. Or if you ask about the sleep, everything is good. If you ask about the appetite, everything is good. If you ask about the mental journals, physical journals, or any other particular peculiars, you don't find anything in that. So yes, then we have to see what are the characteristics of that local disease on that part of the skin, and we have to prescribe accordingly. But in such cases, if there are many symptoms in the rest of the body, then it is not homeopathic to prescribe on only one single symptom, whether it be on the skin, whether it be on the any other part. We have to see the patient holistically. We have to see where the disease has permeated, and we have to understand the whole phenomena and then prescribe accordingly. Okay. So to the second question, whether the treatment of laser, is it justified? See, the problem with the hyperpigmentation is only this, that the people, they don't feel good about it. It does not cause any trouble to the patient. It does not cause any kind of dis-ease. Means it does not produce any kind of discomfort, except from the fact that we have this concept of beauty in us, that if the skin is clear, then only we look beautiful, then only we look good. So it is more of a mental state which is causing us in a state of disharmony. It is more of a concept which is causing a disharmony. Otherwise, there is these kind of, even if they come, they are very silent symptoms that don't cause any trouble to the patient, except from this. Okay. So I think the patient, they should be guided about it. They should be told about it, that it is okay, and the color of the skin, it changes, it can go. Okay, if it is a part of some major disease, we will get to that disease, we will try to cure that disease, and with that disease, these symptoms might go away. If they have just come because of some other reasons, I will not say that it is in a state of they may come, they may not come. But yes, going for the laser treatment just because of that concept is not right. And yes, it can suppress and can create any other kind of deep seated diseases, because it is a symptom which has been caused by the body. But like we have discussed also, that whenever the body is taking a root of local disease, what it is trying to do is, see, there are two one-sided disease. There are two categories. The one is the local disease and one is the mental diseases. If we look at the patients, if we look at our medicinal system, there are two diseases considered to be most difficult to cure. Two diseases. One are the skin diseases and one are the psychiatric diseases. They are most difficult to cure, manage, or treat. Because once they come, and then there are very few, or almost kind of, we can say, there is no other treatment for them. You can manage it, but they will come back again. There might be some periods with the sedatives or with local ointments or some kind of steroids in the local diseases. Once they are stopped, they will come back again. So these are one of the most tedious diseases in the whole array of diseases, if you say. And why? The reason why? Because the vital force, the intelligent vital force, it basically is trying to protect the body from complete destruction. by keeping the diseases as one-sided diseases. There is a threat to the body that if this disease spread, then it can cause that SORA, if it spreads, it can cause a complete destruction of the whole economy. So what the vital force is trying to do, it is trying to keep that disease in a one single organ of the body to protect the rest, either on the skin or on the state of mind. We'll go to those aphorisms also. And it was a very common phenomena nowadays because of the this some diseases, some equipments which have come in the medicinal field, that we don't see much of these kind of things happening. But earlier it used to happen when the patient was, like kind of, they used to tell that, that we doctor used to tell that we cannot do much for this patient, so let him go on his course, just you can just serve him in this state, rest whatever could be done we have done, and we cannot do more. So there were many cases at that time that suddenly a life threatening disease, some, like for example, a woman is in a child in the labor, or she's just on the state of, kind of, that she might die or collapse or something. Suddenly those people, they will go into states of manias. Some patient who is suffering from a very bad lung disease, suddenly he will go into a state of mania or some rage or very severe melancholy, and the whole disease will go away. Even Dr. Hahnemann talks about it in the, we'll talk about it when we'll go with the aphorisms. So when you look at that in that way, many times when you take some strong medicines, some strong allopathic medicine or some other medical medicines, it may cause a side effect in a form of, some skin rashes or allergies. Again, it is a very common thing, because whatever that thing has caused in the body is trying to throw it out. It is trying to take that disease, that medicinal disease, outside of the body and trying to keep it on one of the external organs so that it does not permeate inside, it does not invade inside. So that is why these two diseases, they are very difficult to cure, treat and manage in the current medical system, because they are like a very strong defenses of the vital force where it is trying to save the life. So if we are doing some kind of treatment, we are, going against it, then it might produce some more severe symptoms inside. And definitely these kind of laser treatments, they might have some kind of very bad effects of the laser also. And also if these kind of things, they get suppressed, then they can produce some inner disease, which can be then very difficult to be cured. So we will start with our aphorisms. So we have done till aphorism 214. We'll start with aphorism 215. So till 214, we have discussed about the mind and the disposition, and that how and why they are important in our prescriptions. We'll start with the 215. Almost all the so-called mental and emotional diseases are nothing more than the corporeal diseases, in which the symptom of derangement of mind and disposition peculiar to each of them is increased, whilst the corporeal symptoms decline. So Dr. Hahnemann is saying that whatever diseases we are calling as mental diseases, emotional diseases, nowadays we are calling them the psychiatric diseases, they are nothing more than the corporeal diseases. They are just the physical diseases. They are nothing more than that. The difference is that in this part, in which the symptom of derangement of mind and disposition peculiar to each of them is increased. The only thing is that in this particular case, the same derangement of mind and disposition, which is seen in almost any disease, which we have discussed in the past few aphorisms, that every disease, whenever it comes, it produces some kind of mental changes or some kind of changes in the disposition of the patient. So we see that kind of change So in this case, when we call the mental disease, it is nothing special. Just only thing is that the disease is more peculiar or more spread in the organ of mind and the disposition. It is more increased there, whilst the corporeal symptoms decline. So the corporeal symptom, the physical symptoms are declining, and the disease is shifting to the mind and the disposition. The symptoms of the mind and disposition are increasing more or less rapidly. So either it is in a slow pace or it is in a more quicker pace, till it at length attains the most striking one-sidedness. And it happens till it takes a striking one-sidedness, almost as though it were a local disease on the invisible subtle organ of the mind or disposition. So what happens is that a person was suffering from a disease from a long time, or other symptoms, for example, many symptoms there were, and they were slowly and slowly shifting towards the organ of the mind and the disposition. If you see the patients who are having some kind of schizophrenia, bipolar mania, some severe depressions or panic disorders, or some anxiety or some rage, if you look at the history of these patients, these kind of symptoms they usually are having from a long time. Not this much intense, but yes, if you look at very closely, if you inquire about these kind of symptoms very closely, then you will find, like yesterday I had a patient who has panic disorders. So when I asked them that, is there a definite time when you started having these panic disorders, he said that from recently, from 1.5 years or 2 years, the words are that severity has increased. Their severity has increased, but I have always been like this. I have always been a fearful person right from my beginning. I used to think a lot about something which used to make me afraid. So it is not something that has come suddenly. It has been there, a part of them, along with some physical symptom. It has been going from a long time, and these physical symptoms over a time of period they have been declining, and this mental symptoms they have been increasing. So we see a shift in this kind of diseases, in the mental or emotional diseases, that a shift has come from where the physical symptoms have decreased and the mental symptoms have increased. So again, it gives us a perspective or an understanding that when we have to cure these kind of diseases, like we always talk about, that we have to understand the phenomena. So we have to understand the whole phenomena, how this disease has developed. So it is not something one or some causation which has happened 1.5 years back or 2 years back. No, it has always been a part of that patient. So we have to understand that thing. 1 year back, 2 year back, 3 year back, when it has become more severe, something might have happened. But that was more of a thing which aggravated the thing which was already there. So it was not a cause which has been a fundamental cause for that thing. It might be some aggravating cause, but that does not become important in such cases. What becomes important is that how he has been through his whole life. We will talk about that in more detail when we go to that aphorism. But to understand this, that it is, we have to understand that there is a shift of physical symptoms to this state of mind and disposition. So 216, the cases are not rare. Like I was telling you that it used to, even nowadays it happens, these things. The cases are not rare in which a so-called corporeal disease that threatens to be fatal, a suppuration of the lungs or the deterioration of some other important viscous, or some disease of acute character, for example in childbed, etc., becomes transformed into insanity, into a kind of melancholia, or into mania by a rapid increase of the psychical symptoms. So Dr. Hahnemann is saying that it is not rare, it is frequent, okay, that some diseases which were life threatening, like there was some thysis of the lungs, some pneumonia, some suppuration of the lungs, or some other destruction of some important organ, which becomes suddenly transformed into insanity, which suddenly transforms into some kind of deep depression, some kind of mania, where the psychical symptoms, they are increasing, that were previously present. Again, the same thing. The symptoms are not new ones. It is not that some new symptom has come up. They were always there, but in a very subtle, in a very low intensity or mild intensity, they were always there. If a patient has gone into some severe depression, sadness, melancholia, there used to be some bouts of sadness earlier also. The patients were sad patients earlier also. But now they have suddenly gone into that state, whereupon the corporeal symptoms lose all their danger. And when this shift happens, when this rapid increase of psychical symptom happens, the corporeal symptoms, which were the physical symptoms, which were life threatening, they lose all their danger. They become very mild, they become very less in their intensity. These later improve almost to perfect health. It appears many times that these symptoms, as if they were never there. If some mental diseases of a very, very long has been happening from a long time, the attendants, the people who have been with them, sometimes they even don't remember that they had any kind of physical disease. They will always have, physically he is fit, very strong physically, never had even a fever, never even had some cough, never had any coryza, because that all is shifted to that state. So these later improve almost to perfect health, or rather, they decrease to such a degree that their obscured presence can only be detected by the observation of a physician gifted with perseverance and penetration. Or they become obscure, or they decrease to such a degree that only a physician who is gifted with perseverance and penetration, who has a very strong observation, who has a grit that I need those symptoms, I need to ask about them, I need to find them, then that kind of physician can see that yes, these symptoms are still there to a very small degree, they have not completely gone, but they are still there. In this manner, they become transformed into a one-sided and as it were a local disease in which the symptoms of the mental disturbance, which was at first but slight, increases so as to be the chief symptom. So that whole problem, it basically transformed and shifted to a local organ of mind as if it were a local disease. And then that symptom became the chief symptom instead of some physical symptom which was very strong earlier, and in a great measure occupies the place of the other corporeal symptoms whose intensity it subdues in a palliative manner. Again, very important word, palliative manner. So it takes place of the other symptoms in the body. The whole, like I told you, that whole disease gets concentrated to then that one particular organ, and we call it a local disease. And why it happens to palliate that? It happens in a palliative manner. It has palliated those corporeal physical symptoms, not cured, they are not gone, but they are in a palliative state. So that, in short, the affections of the grosser corporeal organs became, as it were, transferred and conducted to the almost spiritual, mental, and emotional organs, which the anatomist has never yet and never will reach with his scalpel. So the whole look, the physical phenomena, the whole phenomena of the disease, it is transferred to that invisible spiritual, mental, and emotional organ of mind. Dr. Henneman says that it is such an organ where the surgeon or an anatomist can never reach with his scalpel. That is why it will be not able to cure that part, that disease, by the methods which we are commonly seeing. They can never help that patient. So in these diseases, we must be very careful to make ourselves acquainted with the whole of the phenomena. So the first thing which we have to do is we have to be very careful. Careful in what? In understanding the whole phenomena, both those belonging to the corporeal symptoms and also, and indeed particularly, those appertaining to the accurate apprehension of the precise character of the chief symptom. So the first thing, we have to be very careful in understanding the whole phenomena, the phenomena which consists of the physical symptoms which were there, and now it has shifted to the other part of the brain. But like Dr. Henneman will also tell this thing, but somewhere they will come back. You will always see those physical symptoms coming back whenever the mental diseases, the symptoms have the intensity has decreased. You will see those physical symptoms sometimes coming up in some kind of seasons, in some kind of situations, in some kind of uh, uh, when the patient is in a more stable mood or in a more stable mental state, so those symptoms will come back, although minutely, although for a less time, but they will come back. And if we have this understanding that we have to look for them, then we will indeed see those symptoms. And if we ask also to the attendants, uh, and many times the attendants, they tell about those symptoms. So those appertaining to and the second part is first the corporeal symptoms, and then particularly accurate apprehension of the precise character of the chief symptom, of the peculiar and always predominating state of the mind and disposition. So now the chief symptom is the state of the mind and disposition right now. That has become the chief symptom in these cases. So a physician has to understand the peculiar character of that. For example, if a patient is suffering from some kind of delusions, so we have to characterize it. What kind of delusions are there? Okay, is there some particular underlying theme of those delusions? If the delusions are ever changing, they are of no use to us. But yes, if there is some underlying this thing, for example, there was a case I have discussed. I think most of you have heard about that case, a case of Lekes's patient who used to hear, he used to have auditory delusions. He used to hear that someone is scheming against the country. So he will go to the police, he will go to the CID and tell them that, I can hear, I have this power, I have gained a power by which I can hear their satellite communications. The people, they are trying to attack in some part of India, and I can hear them. So he would say that now they have come to know that I can listen to them and they are threatening me. They are saying that we will kill you if you tell to the police or you tell to the army. So he used to go everywhere to tell everyone that I have this kind of this thing. So that auditory delusion, that becomes a very characteristic part of the chief symptom. So similarly, if there is some kind of confusion of mind with that, any kind of dullness of the mind, or if there is some kind of anger, then how the person is behaving in that anger. If a patient is suffering from some kind of panic attacks, then how is the usual mood with that kind of anxiety? Like one of my patients again, he used to have a very severe hypochondriasis, very severe. Like every month he used to do some MRI or some scanning of the body. He always had that, this fear that the doctors are not able to understand. He used to feel this pains around this area, in the back, sometimes in the cervical region. And his mother had suffered from cancer. She died from the cancer, and that had a huge impact on him. So he used to do lots of tests, echo, ECGs, MRIs, and whenever he would do, he would be in this thing. He will always become very sad. He would weep also. Okay, so hypochondriasis, it is a chief symptom. Anxiety or this fear of disease is a chief symptom. But the characteristic was that whenever he was into this state, he would become very sad, very depressed. He will not talk with anyone. He will be silent. He does not want anyone to talk with him. Otherwise, he was a very extrovert person. Otherwise, he would like going out with the people, like doing his work, his job, very sympathetic, very generous person. And he would all like, after he became well, he would always tell me, doctor, we should start a camp for the children which you are doing. We should start in this city, we should start in that city. always very enthusiastic to help others, and animal lover, very this thing. So, but he had this character. Whenever he was into a state of hypochondriasis, he would be very sad and does not want to talk with anyone. He used to have pigeons, which he loved very much, which he took care of a lot. And at that stage, he would even stop feeding those pigeons. He would stop looking at his dog. He would stop taking him out for a walk. And he would be in a very, very deep, sad state. And this is a very characteristic of phosphorus, this particular part. Phosphorus we usually do not think about when we go into this hypochondriasis, but it is one of the main remedies when this kind of state happens. And whenever they're in a state of hypochondriasis, they go into such very, very deep sadness. A very, jovial person, a very happy person, a person who has lots of energy, and going into such state. And he is completely out of that state now. Even now, if he sometimes gets symptoms, he does not bother about that. He would not even go out of the city at that time. That if I had a symptom there, then my doctor, how will I contact my doctor? How will I contact him? How will he give me medicine? Because he was taking the homeopathic medicine. He had a belief in homeopathy and me. So he would say that, doctor gives the medicine from his clinic. It is not like allopathy that I can take it anywhere. So how he will give medicine? So his son has been calling him to Australia from past 10 years, and he did not went there. He did not went for his graduation. He did not went when he started his job, because he said that I cannot come. If I get sick, then who will give me the medicine? And recently, after getting better, he has gone 3 times to Australia. 3 times for 1 month, 1.5 months. And now I sometimes jokingly ask him that now you are going to Australia. If you get some problem there, how will you manage? I jokingly ask him. Yeah, don't worry. I will just call you. I will just call you. So, so we have to understand the whole phenomena. This characteristic of the chief symptom and the corporeal symptoms which they used to have, or which sometimes comes now also, in order to discover for the purpose of extinguishing the entire disease. So, among the remedies whose pure effects are known, a homeopathic medicinal pathogenetic force, that is to say, a remedy which in its list of symptoms displays with the greatest possible similarity not only the corporeal morbid symptoms present in the case of disease before us, but especially this mental and emotional state. So it should not only cover the medicine which we are selecting. It should not be only similar to the morbid symptoms of the corporeal character or the physical character. Not only the physical disease symptoms should be covered, but especially this mental and emotional state and its characteristics. Okay. This finding of characteristic is very important, because, for example, all the patients who are suffering from, if we go into the name of the disease like schizophrenia, everyone is suspicious. Everyone is suspicious. So suspicion is a very common thing among such patients. But we have to understand that there is always some characteristic to those kind of things. We have to find that characteristic. What change happens into them when they are into that state? Is there any characteristic? Is there any characteristic in their behavior which they usually do when they are into, for example, a patient, a person who is suffering from some kind of anger disorders, some rage or something. Whenever he goes into he starts abusive. He starts becoming abusive. Although he's not, especially when he's not from that kind of background, familial background, like a person, there was this patient, he was a teacher in a university, and he comes from a very decent and a background which is very manneristic. Like his father was a teacher also, mother was also a teacher, and they were at very good posts, and this person is also a very good post. And when you inquire about him that has he been like this, like abuse, everyone will say that this is a completely different person. He was a very subtle person, talking very carefully, seeing how the state is managing, how the things are in a very responsible way or in a very beautiful way. And suddenly such a person, when in anger he becomes abusive, that becomes a very characteristic thing. So that becomes a characteristic of that mental and emotional state. And our remedy, along with the physical symptoms, whichever there are, we have to we have to form a picture and find a remedy which basically corresponds or is similar in greatest possible meaning to that particular picture. So aphorism 218, to this collection of symptoms belongs in the first place the accurate description of all the phenomena of the previous so-called corporeal disease. Like we have discussed, that all the phenomena from where this disease has shifted to the mental disease, the phenomena of that disease, that physical part, it has to be accurately described, has to be accurately understood before it degenerated into a one-sided increase of the psychical symptoms and became a disease of the mind and disposition. This may be learned from the report of the patient's friends. Okay, so this we may learn from the patient's attendants or friends or the family members. A comparison of these previous symptoms of the corporeal disease with the traces of them that still remain. So once we have asked from the parents or the attendants or the friends of the patient that what were the physical disease which was before this state has come, and now if we compare with the traces of them that still remain, so like I told you earlier also, that there will be some symptoms which will be still there, though they have become less perceptible, they have become very less perceptible, they have become less prominent, it is difficult to see them or analyze them, but which even now sometimes become prominent. When do they become prominent? Even now, when a lucid interval or a transient alleviation of the psychical disease occurs. Transient alleviation means a small amelioration. Whenever the psychical symptoms they are ameliorated for a small time by the situations, by some kind of something which is something is going according to the patient is happy, there is little alleviation, amelioration of the psychical disease, those symptoms they will come back, they will become prominent. Some kind of diarrhea, some kind of changes in the, for example, the same patient who was, like I told you, who had this auditory hallucinations. So there were some bad days, there were some good days. On good days, whatever was his coryza will come back, he will start having this cold, you know so will serve to prove them to be still present, although obscure. Okay. So this also tells us that those symptoms are still present. They have not gone anywhere. Like Dr. Hahnemann, he used the word that they are basically in a suppressed state. They are not gone anywhere. They are still there. They are still the part of the disease. So it also gives us a relation that whenever the psychical symptoms increase, the physical symptoms decrease. And whenever the psychical symptom decrease, the physical symptoms they come back. So they are basically so much interrelated with each other, and they become a they make a very characteristic picture of finding a simillimum remedy. So that is why we have to become acquainted with the whole phenomena of this physical disease which has happened or which has been happening before it shifted into this part. And there was this one more boy who used to have suicidal disposition, suicidal thoughts. So similarly in his case also, whenever he will become a little better, he will have very severe headaches where he will start becoming more confused. He will become more dull. He will be not able, for example, if he was studying in the college, so if he had this exams, and he will become very confused which exam is tomorrow, like which I have given, which I have to give. He will become confused in them. So this was very characteristic of that patient. So by adding to this state of the mind and disposition accurately observed by the patient's friends and by the physician himself, we have thus constructed the complete picture of the disease. So by adding the state of the mind and disposition to this part, to this characteristic of the physical symptoms, or which are still there, we have completed the picture of the disease, for which in order to effect a homeopathic cure of the disease, a medicine capable of producing strikingly similar symptoms and especially an analogous disorder of the mind must be sought for among the antisoric remedies if the psychical disease have already lasted some time. Okay, so out of them we have to find an antisoric, we have to find a similimum remedy, which is basically similimum to the disorder of the mind, to the state of the mind, and to the physical picture of the disease which preceded, which was there before this disease came, this mental disease came. So this is the idea about the how to deal with this mental diseases. Because without considering this whole thing, we will never be able to treat the patient. And this is a key. If we suddenly go and give stramonium, belladonna, and veratrum, and hyoscyamus, or these kind of remedies, we are just looking at the mental picture and ignoring the physical phenomena which had been running behind it. So that is why these kind of remedies, they don't give a permanent. They might again ameliorate certain symptoms. For example, you give stramonium, it will ameliorate certain symptoms of the patient. You give belladonna, it will decrease the anger for some time, but it will come back. So it again acts in a palliative manner, because we have not considered the thing which had been there before this disease has come up. And moreover, at least in understanding a general state of mind, when we look at a patient that okay, he's suffering from uh, some kind of sexual mania, erotomania, he's suffering from that, at least we can rule out the remedies which don't belong to that stage. So just the understanding of this thing, that what kind of a general state of mind is going on, like we were discussing last time also, that rule out basically happens when you know that what kind of general disposition is of the patient and what kind of the general disposition a remedy possesses. We have done that footnote to the aphorism that Nakswamika will never be uh, able to cure if the patient is of a yielding disposition. So whenever patient is yielding, we know that we have to rule out all the remedies which are predominantly obstinate. So similarly in this state also, when you see that a particular kind of mental state is there, we can rule out all the other remedies which do not have those kind of states commonly or generally. So if a patient is suffering from melancholia, at least we will have this thing that we should not give belladonna, stramonium, or veratrum in such cases, because they don't have this kind of state of the mind. Okay. So we will stop our lecture today here at Aphorism 220. I will again request you to go through this. These kind of diseases, homeopathy is the only answer in today's time. You all have experience in homeopathy, in the medicinal system. Many of you are doctors who have been practicing from long time. You have seen such cases, how they have been suffering from so long. And at least we know that there are no other medication, because the other medicines, they're not working in this way. They're not trying to go through the patient or understanding the patient in this way. So that is the first reason why those medicines, they don't have that power to cure the patient in a complete manner as it is meant to be, for a longer period, for a permanent period. Why these medicines, they are not able to help? They can help for some time, they can manage the patient, yes, they can help with that thing. But when our aim is to bring the patient back to health, then we should go with that mindset in such cases. So we have to go through these aphorisms because these kind of diseases are on the increase. The reason that the physical phenomena are being suppressed in a more rapid way by many kind of treatments which are going on nowadays. So we have a rise in these kind of diseases in recent times, and we have to understand that we are the ones that can help those patients. So we need to understand it in a more deeper way, that how we can go about these things through our, now like I told, and these all things are given in our materia medica. If we can understand the organon, if we can just understand this part, now after understanding of these particular aphorisms, when you go back to materia medica of phosphorus, you will find the same thing which I have told you today, because it is written in the materia medica, but we didn't had a mirror to look through earlier. Organon helps us like a mirror. It helps us in searching like a magnifying glass. It helps us to search what we are looking for in the materia medica. So now if you go to the phosphorus, you will find these things which I have said today in the materia medica of phosphorus. Because now you know that there is some this similarity which is there. There are some peculiars which we have to find in the mental and dispositional part of the patient, and now you can hit upon that thing. So when you go through these aphorisms again and again, you make a link. You go through the aphorisms, organon, you go through the materia medica, you go through the aphorism, you go through the materia medica, you start forming a link. And that link is what transforms into our case taking, into our analysis, and into our search of remedy. If I am reading materia medica with one mind and the organon I have never gone through, or just few aphorisms I have gone through, I have not formed a link between these things, then it becomes very difficult. And it becomes very difficult to understand miasms, because nowadays, like recently when we had been in Thailand, I have talked about syphilis when we were discussing Merck. So recently, from past few years, I have few cases which have responded to that kind of anti-miasmatic treatment. I will not go into detail right now. It is a long thing. Where the problems they have developed from syphilitic miasm, the syphilitic miasm which Dr. Hahnemann has told us about, which is linked to the venereal diseases. Because when you have to form the link in all the things which are homeopathic, all the homeopathic literature, you have to go through them again and again. And when we are doing these classes, when we are doing these lectures, we have a 1 week period in which we can go through them once or twice, try to understand, try to make a link with the previous aphorisms, try to make a link with whatever we have talked, try to make a link with the materia medica. For example, if you go to the lachesis part of the materia medica, you will find these kind of characteristics there. If you go to the sulfur materia medica, you will find those mental characteristics there. And if when you will see that in the patient, someone who is suffering from those kind of psychiatric diseases, immediately the remedy will hit your mind. The remedy will hit, because now you know the aphorisms, now you know what you are looking for in such cases. Earlier we were just kind of throwing the darts in the dark. We didn't know what to hit. Everything, we didn't know what is the target. We do not know. So organon, these aphorisms, they give us a way how to proceed in such cases, how to understand our materia medica. So now whenever now you go through the materia medica, if there is go after this, go for the materia medica of Meserium and Dr. Kent's materia medica. Just read Meserium and see how he tells that those skin symptoms, how they change into something more drastic, something more bad. All the materia medicas have pointed these kind of changes. What happens after this, what happens after this? We were not able to establish that link. Then if you go to the mesothelium, you will start understanding that indifference part of the mesothelium, how it is developed and how violent it is. So when, because like I have told you that you cannot memorize materia medica, it has to be understood. So these aphorisms, this organon helps us in understanding the materia medica, how it is to be understood. So just now you just go give a reading to mesothelium. It is a very small, I think 3 or 4 pages max. You can just do it in 15 or 20 minutes. Try to understand, try to see this link in that remedy. And then you can, make up your mind that, okay, if a patient comes with this kind of condition, who has come from this kind of state, mesothelium is the remedy. And I'll wait for such kind of patient to come. And whenever he comes or she comes, I'm going to this remedy and I will see that beautiful cure happening in front of my eyes. Okay. So first go read the mesothelium, feel about how you have understood this thing, you know, keep that thing inside, think about it, and then you go back to those aphorisms and then read them again. And you will have a more clear picture about what we have talked today. So with that, good night to all of you and thank you very much.